Hey everyone, my name is Debbie Cheng and I'm here with YC Sun from IDEO. Really pleased to have you on the show. To begin, could you give me a brief introduction of who you are and what you currently do?
Hey everyone, my name is YC. Happy to be here. I am a designer, educator, and general sort of artist and community builder. Those are the top 4 pillars of my life.
Awesome. And for those who may not know, do you mind talking a little bit about what IDEO does and how it's unique as a design consultancy?
Sure. So IDEO is a global design and innovation consultancy. It's been a company in existence for almost 40 years now. And it is basically the design firm that put design and sort of a human-centered approach to design thinking into the general zeitgeist. It started off 40 years ago with our founders, Dave Kelly, Tom Kelly, and a few others to really bring industrial design, that was sort of hot thing, into the world of business. And really starting off, some of the early IDEO work was with Apple and Steve Jobs and working on the computers like the Lisa and Apple II. What started off mostly in sort of electronics and personal computing products, then expanded into broader product design in every industry. And you can probably go into anyone's home and you will find objects that have been designed by IDEO or can trace their lineages back to IDEO projects. And now IDEO is sort of a global organization. We have offices across Shanghai, Tokyo, Singapore, London, and a couple in the US. And we work across all industries and do much more than just products design. Sort of the mentality is how can we use a human-centered design mindset in order to solve some of the most challenging and complex issues in our present day. I personally am leading our work within healthcare. I help lead the healthcare portfolio within San Francisco, and I focus a lot of my time on how do I bring well-being and more preventative health and improving access within the healthcare ecosystem.
That's awesome. Thank you for such a great introduction of IDEO and what you do. For those who might not know about human-centered design, can you tell us a little bit about what that is?
Yeah, I mean, human-centered design is more of a mindset. I think a lot of design schools or other agencies may boil down to certain methods, which that's a bit reductionistic, but at its core, it's about starting with people when trying to address complex issues. We like to often say that to create a sustainable, let's say, a business out in the world that both is effective and earns money, there's a Venn diagram, and you need to approach the problem at the intersection of human desirability, feasibility, whether technology or operations, and business viability, whether it's the strategy and sort of the revenue model. And innovation lives at the center of those three, but the way to get to that center is from the human desirability. What that means in terms of the methods I have mentioned is that it starts with a lot of understanding our target audience, whether it's the end user or the people in between the end user and your product or service, and really understand unmet latent needs. There's something that I like to say is that there's often gaps between what people say, do, and feel. And it's your job as a designer to be able to understand those gaps and then be able to think of solutions within them. And tactically, that means a lot of contextual interviewing, a lot of mixed method qualitative research. I'm often in the field, whether it's in a patient's home, a doctor's office, and doing qualitative interviews to be able to better understand people's emotional and functional needs. This is very different from how potentially many consulting firms approach research based off of secondary research or expert research. While we do a lot of that, one of our core beliefs is that we have to strongly anchor on the qualitative stories that we see in the field.
It's really interesting that you said a different approach to research versus consulting is doing all this contextual interviewing. Can you explain a little bit about how you assemble your team to be able to do this? What are the kind of experts you like to have on your team? And are they integrated throughout the entire project? Do they come in at different points? Can you elaborate on that?
Yeah, our teams are staffed full time. You can sort of think of them as a mini startup when they are giving a sort of scope and a challenge of work. They're all multidisciplinary teams. We like to use the analogy of like the paint drip individual. So someone that has basically core specialties. You might have multiple specialties, hence the paint drip, but are able to go through the entire design and creation process and have a foundation in that. I, myself, my specialty is within digital products. And before that was in more electrical engineering. I studied electrical. My sort of specialties work was in electrical engineering, prototyping, and hardware development. I've broadened over the years, and now I sort of think about broader ecosystem strategy, product strategy, but we still do a lot of work within creating physical products. And within our teams, generally they range between 3 to 5 people with very differing skill sets. So I would say a typical project, just an example, I worked on a project pretty early in my career with Yosemite National Park to basically be able to address traffic congestion within the park. That team consisted of a design researcher, someone who is very skilled at interviews, very skilled at coming up with a research approach and organizing the mixed methods in order to get the information that we need to do ideation. We had a data scientist, someone that was working on understanding the quantitative data that the government was and the Park Conservancy was collecting. We had me. At that point, I called myself a creative technologist, someone who is a prototyper and uses technology as sort of their paintbrush, which basically meant that I was more of like a hacker type and could basically build anything very quickly, whether that it was in software or hardware. And then we would have, generally, I would call it more wild card, more specialist designers. Most teams have this sort of arrangement of a researcher, more of a technical or prototyper person, and someone that understands human interaction. So we call those interaction designers, which generally means that they're looking at the world from a more conceptual human interaction point of view and coming up with whether that is a UI, UX, or if it's a product or service. And then we have subspecialties within that. And then for the Yosemite project, for example, we had an experience designer. So someone that was a community builder, someone that was skilled at setting up events, because we were doing intense co-design with park rangers, the people that were attending the park as a tourist, and the businesses and the political leaders that served as in the towns surrounding Yosemite. I lived in Yosemite for 2 months. We were talking to park rangers, we were talking to tourists, and hosting co-design workshops with community members to trying to find root causes and to ideate around potential solutions.
How do you decide or how do you track and measure the success? How do you know that what you did was what you set out to do from the beginning?
Yeah. I mean, we like to be able to launch pilots with our clients, especially within the healthcare and medical world. A lot of what I do is building confidence in order to allow senior stakeholders to invest more resources along a certain direction. The work involves the early venturing and de-risking in order to say like, hey, let's invest a couple million more dollars to do the production development, iterative production development, in order to be able to launch to pilot partners, whether that's a clinic or a community. And we are often working with our clients to set up those pilots and trying to figure out how to track either if it's early on, the indicators of success, the leading metrics of success, or if it's a sort of later stage product, the analytics, the actual quantitative measures of success, which tends to be less often. A lot of our work tends to be around new products and services and experiences. So oftentimes they do not have the millions and millions of users. But we do work with very large firms that sometimes want to pivot or add new business lines into their existing products.
I also came from working at like a UX strategy agency. So I saw a lot of different industries, and clearly you went from working with the park to more digital health. How did you figure out and slowly make your way toward focusing on the healthcare space?
Yeah, well-being is a big part of the human experience. IDEO has always worked in the healthcare well-being space. It's always been a core part of our focuses. I've always worked on those projects, even as a more of an individual contributor on projects earlier in my career at IDEO, and I've enjoyed them immensely. Something around healthcare has always been that you can very tangibly see the impact of your work on the patients and providers. If you're working with oncology, you are interviewing patients with terminal illnesses. If you're working in diabetes, you see the change in people's lifestyles. It's very concrete. And for me personally, I find a lot of resonance. The other main reason is that when COVID hit, so much of my work specifically became actually first response. I was working on multiple COVID telemedicine platforms to be able to help providers both triage and also provide care through telemedicine during those early moments in pandemic when no one knew what the fuck was happening. And we were also working on things like antigen tests, creating the physical products that were then brought by pharma to paid for by the government into people's homes, and doing the human factors research to create tests that people will generally flawlessly use, and working with health systems on how to provide vaccines came along and the world was settling down, what to do with the new world. We were working on vaccine passports, new ways of working for organizations, and what software was needed for companies to feel confident about going return to work, in addition to like long-term care now for chronic illnesses that has been exacerbated due to the epidemic. I personally found a lot of meaning all throughout the pandemic and decided to double down since then.
That's great. Yeah, I think it's super important to work on something that you're passionate about. And I'm curious on when it comes to actually getting people to try out and adopt the products, what are the biggest challenges and what do you think are some of the key ways to get people to adopt a new behavior change?
Oh, there's so much here. I mean, there's a design perspective, there's the behavior change perspective, there's the medical perspective, all which I can give many different ways of thinking. Firstly, from like a general design perspective, good design encourages behavior and creates flywheels for behavior. A lot of the work that we do as designers in the field involves, again, those unmet needs that will catalyze behavior, right? And building affordances in your physical or digital products that lower the barriers to engage with that behavior. We often talk about what are the key moments or signature moments within a product that will be able to hook someone in, and how that key moment is a differentiator that solves their problems. I would say the key moment is the instantiation of the value prop of whatever you're trying to make. But around broader behavior change, I mean, that's incredibly difficult. I've been working in healthcare well-being now for a decade. If we can solve that, there would be no problems in the world. Motivation is not something you can change, but you can change the environments that people have and the ways they think about that environment. So a lot of when I am thinking about behavior change for like a healthcare benefit, it's how do we make the task so small that people can do it no matter what contextual moment they are, no matter what emotional or energy or time that they have. And then how do you build the nudges, whether that's through community, through authority, through games and personalization, to get people to feel more connected with the experience that you are trying to create.
I know you mentioned behavior change. It varies between healthcare or products. So is there any specific challenges that you see within the healthcare products that you build that are unique to it?
Yes. I mean, there's many systematic challenges designing for healthcare. One of the hardest, I would say, is that oftentimes there are many gatekeepers in the way, not necessarily in a negative form, but oftentimes selling and creating something directly to consumers is not the most effective way of driving engagement in the healthcare system. You want to sell to payers, you want to sell to health systems, and within those are many different types of people, whether there are like benefits managers or doctors, and they have their own needs that are separate from patient needs. As a designer working in complex systems, healthcare being one of them, finance might be another, it's not just purely building for what is the most desirable. That's why I talked about that Venn diagram. Oftentimes with designing for healthcare, you also need to design for what is operational feasible. Everyone would love to have a doctor 24/7. We don't have enough doctors in the world to do that. Not even like non-clinical staff to do that. If you're going to provide better human-focused care, which is the ultimate goal, as much as people talk about how AI can scale, ultimately what's going to drive behavior change are those human-to-human connections. Then if your product makes things 10% slower for doctors or more effortful for nurses, no one's going to use it. So the integration within how care is being delivered is so important. The other part is who's paying within healthcare well-being. People are not used to paying out of their pocket. And if you're making a product that makes people paying out of pocket, you're almost exclusively serving people that are wealthier, people that have access already, and people that generally already have healthier health outcomes. And if you want to be able to make something, and like me, that wants population level impact, you can't just make a direct-to-consumer platform.
Yeah, that makes sense. At Wharton, we have an entire major for healthcare management, just because there are so many challenges that you just mentioned. It will definitely take different types of people. Let's shift into more future thinking and maybe optimism. What are some things that you're really excited about in digital healthcare that you'd like to contribute to?
Yeah, things that I'm excited about in digital healthcare. Personally, I'm very excited about increasing of access. We're already kind of seeing it with ChatGPT and people using it for informing their own self-diagnosis journeys. And to me, that's a good thing. I think equipping people with stronger understanding and education is generally something that our healthcare system is hard to do. There's no one paying for it. To me, that is an amazing thing. And how that new wave of people who are more equipped of understanding their bodies might motivate them to seek out new services. I'm not talking about like AI coaches and AI doctors. I don't think we're going to go into that world, to be honest, nor was it effective. But I'm talking about how AI can increase the motivation and nudges for you to seek the right care. I'm also really excited within digital health is the potentially consolidation within the market. Right now, there are a lot of acute and point solutions, right? There is the platform for diabetes. There's a platform for migraines. There's a platform for migraines for this specific population. And while ostensibly good, I think it leads to a lot of overload, actually, in the end for the patient dealing with multiple things. What I'm actually really curious about is how can our new tools and potential time that are now freed up by these tools helping our doctors and nurses allow for them to do more integrative care, more lifestyle support that takes into account of all the different conditions of the body rather than just saying, hey, you are a patient with, say, diabetes.
Do you think we should focus more on tools to help the doctor, or do you think we should give more power and tools to the patient?
I mean, this is a trick question. You need both.
Yeah. Which one do you think you would tackle first?
In my position as someone that works across the ecosystem, you have to attack all of them. Mm-hmm. If one thing as a designer, is taking more of a systems point of view on things. I mean, this is not just the industry that I focus on, but in all industries. Oftentimes, right now, at IDEO, we have a portfolio of work that's focused on climate action and helping climate change. And one of the stories we talk about is that decades ago, IDEO helped design some of the first toothbrushes, both electric and physical. The toothbrushes, especially that had grips that were used rubber to conform to your hand. Colgate sold billions and up to billions of these. And these are the ones that litter our seas and are in landfills. They're not degradable. They're plastic. They will run forever. Those are things like, as designers, we prioritize just the human factor here. We wanted something soft for kids and for the elderly. We weren't thinking about what does it mean if you actually sold billions of this and what it might mean for the systems of responsibility that we now live in.
Yeah, definitely some of those impacts we have to now consider. I guess because you kind of mentioned learning about different design skills, I do want to touch on what you do at the D.school. But before we move on, last thing is, do you just want to share your most proud project that you've ever worked on?
I mean, so many projects that I'm very proud of. Probably the most proud project I have is this collaboration with the California Department of Mental Health and a service provider named Kuth to bring free behavior and mental health coaching to youth in California. This was funded by basically Gavin Newsom, putting up millions and millions of dollars to trying to address the mental health crisis amongst youth. I don't need to go into numbers, but it's a big problem. What we did with the state of California and Kuth, which is a text-based service provider, was to co-design with youth across California. So I think our panel was probably over 200 youth all across in different socioeconomic and demographic characteristics to create both the content, how to engage with the content, the tools, how to engage with the tools, and how coaching, and this is subclinical behavioral coaching, functions, looks, and feels within this platform, right? And doing it very quickly, launching a proof of concept with 50 youth, getting amazing public results, and then now scaling that to all of the state. This is a product called Soluna. It's accessible and free in all 60 counties within California, and it's getting a lot of really high reviews. I mean, the NPS scores are really high, which makes me feel proud. And the fact that I am building something that is free and accessible and doing something that is moving the needle, the world needs more of this.
I completely agree with that. I'm curious on whether this demographic, these younger people, interact with technology differently than someone a little bit older.
Yeah. Just to clarify, by youth, I mean 13 to 25. So the range legally is quite broad here. But yes, there's a lot of different developmental gates within that 13 to 25 range. And I mean, since we do work for kids, we also do projects for the elderly. It is very different mindsets. And that's part of why we go through and do that contextual interviewing, partially to learn about their needs, but more importantly, is to build up your personal designer's intuition and empathy towards your target population. And that's what's so important. And I think is often not as taught in business school, is that, yes, the numbers and the TAM of the market is important, but your personal connection with your users might even be more important.
That's a really important call out. I've noticed we have a lot of consultants in business school, and they're always behind spreadsheets. Maybe they do some interviews, but not a ton. I completely agree. It's important to actually be with users. And speaking on that note about things that are not taught, I wanted to touch on your work at the Stanford D.school. I think it's a really unique school. And you teach two courses, Design for Extended Realities and Design for Healthy Behaviors. Can you talk a little bit about those two courses and what inspired you to get into teaching?
Yeah, broadly speaking, I find teaching and education as a pillar of being a professional. If you're not teaching, honestly, I don't know how you think you're going to up-level your craft as quickly. Teaching forces you to conceptualize and make concrete what is it that your specialty is and how to communicate that. And whether you are a designer with a label designer or someone with a different major or different line of business, there is a craft to it. And being able to teach the craft will make you a better person. I've always taught, but at the design school at Stanford, I've taught for the past 4 years now. And Stanford in particular enjoys having a lot of industry lecturers within its system. And the design school especially relies on industry lecturers to be able to teach things that the core curricula cannot do. For me, I love doing sort of more entrepreneurial, more project and product-based courses for the two courses that I teach. One is Design for Extended Realities, and that one's focused on AR, MR, VR technologies, things like headsets and glasses and haptics. And the core premise is this is a very big area of investment for many tech companies. It's less of a, I would say, market on the user side. How do we flip that? How do we begin with user research and need finding those opportunities, talking to users to actually find tangible use cases for these technologies, and then prototype and build for these users. And the class ends in a sort of a mini conference at XR Expo, where I bring industry leaders, VCs, and the public for people to experience the products or experiences that students make in that quarter. And along the way, they learn how to do research. They know how to think about ethics and harms. They learn how to make prototypes within this ecosystem so that people can actually experience it at the end. The other course around designing for healthy behaviors is focused on healthcare. And the core premise is around pairing students with patients from Stanford Medical. And these are patients that the normal fee-for-service treatments cannot resolve. So these will be patients with multiple comorbidities, multiple chronic illnesses. They tend to also have mental health that they're dealing with. It's not something a pill can generally solve. We pair patients to students in groups of 2, and they have the entire course to basically learn lifestyle change, behavior health coaching, and actively basically learn how to be a coach to try to change the life of this one patient from a very design-centered mentality and create interventions, whether those interventions are a physical product, which sometimes happens, or if it's a plan or creating community and connection with that one patient, and really push students to try to change one person's life before they try to think about changing a population, and realizing how much work is actually needed and better understanding if their end goal, which we get a lot of MBA students who take the course that want to do something in healthcare, realize often how naive or misguided they may be in thinking about using scale to improve health.
That was actually a follow-up question, is what are the types of students that take these classes? You mentioned MBAs, but what other schools are there?
Yeah, for both my courses, it's predominantly grad and upperclassmen, with the underclassmen being more of the exceptions. Many from MBA, many from the engineering schools, and more specialist schools like legal, like the law school or the medical school. So we generally try to make every year quite diverse.
Actually, I also thought of another thing is for those who are not labeled as designers, like the ones in law, medicine, engineering, and business, how can individuals weave design thinking into their own roles?
Yeah. I think human-centered design is, again, more of a mentality, this idea that through cycles of human-centered research and prototyping, you can land on more unique solutions. There's often at times a very inherent optimism that you can change the system and you will be able to uncover something that isn't just an iterative 10% efficiency. There's that sense of belief, I think, that should belong at every single level that we often don't find in certain disciplines. A lot of my work, for example, is I work with a lot of doctors. Doctors are not trained to innovate in a way. They're trained to follow medical algorithms. They're trained to decrease liability, and generally, eventually, it creates people that are more risk averse, which is why this approach for human-centered thinking oftentimes is very shocking for clinicians and sort of pushing their comfort zone. But that's helpful because then they bring up sort of the feasibility checks, they bring up things to think about, but we try not to make that the guiding principle for how we think about innovation. The guiding principle is it's possible to create the change and have disproportionate impact through design. And I think for people that don't come from a design background, it's creating the space to do that. Good design takes time. Good design often looks like scrapping things and going back to the drawing board. It's very different from like, hey, we have this idea, let's go build this immediately and invest lots of resources to create that thing. It's creating prototypes in almost any means possible. As a technical person, one of my actually core roles was to spend as little time as possible doing the technical engineering. If I could fake it using role play, if I could fake it using cardboard or foam core or projectors or something else, I would do that because it is both faster, it's more immersive, and I would rather spend my time learning than making something.
Yeah, that is a very useful guiding principle, is being iterative. And I think that we can all take a note from design through that. I guess I want to start to head towards some closing career-related questions for you. Actually, I'll start with your background specifically. So you started off as like an individual contributor, you then became a product lead and then senior portfolio director. How did your responsibilities and scope change throughout those years?
Yeah, I mean, as a product designer and core team member, my scope and responsibility was to be a part of the full creative process, being part of every interview, being part of brainstorming. But really my specialty was creating the prototypes, making our ideas tangible as quickly as possible, and being okay with throwing it out. And whether that was being done through software or hardware or something, a mix of both. As a lead, I like to say that at IDEO, project lead is basically a mini CEO. You have full control over how the project goes, the budget, and the approach. It basically means that you are responsible and accountable for the success of what you are making and bringing people along that process. And now as a director and actually a portfolio director leading sort of a portfolio of work within an industry, I spend a lot of my time as a subject matter expert for teams, providing guidance and my understanding of not just the field, but also of the users through my years of building products and services for different groups of people, and also how to bring things out into the world and leveraging my network to be able to support projects, and also being out there in the world to bring in the projects that we find impactful into IDEO so that our designers have things to work on. So doing the business development and scoping and the partnerships that will sustain our business.
What's the best way that you found to keep up with emerging technology trends and also kind of those pockets of business opportunities?
Personally, as a creative technologist, I do think one of my core specialties is technology. So I do spend quite a bit of time reading and being on like Hacker News or being on other more specialty forums and having a network of people that I talk to regularly around what does it mean to explore the edge. And I'm in futuring groups, I'm in creative tech groups. So being aware of what people are using, even if day to day I'm spending less of my time building and using the APIs and SDKs and hacking things together. Within the industry, I'm often out in the world giving talks at workshops and being at conferences and regularly having conversations with leaders in other organizations about like, hey, what are we thinking the world's going to change? The world has been shifted quite a lot the past 2 years. What people are doing to both maintain innovation, but also maybe possibly cost cut and also prepare themselves for more ambiguity. And those are conversations that I have with senior stakeholders across the industry.
Yep, that makes perfect sense. And yeah, being able to host these conferences and workshops are so important. My last question is for people who want to help build these digital health products and kind of break into that space, what career advice would you give them?
Specifically for digital health.
If you want to go broader, that's fine too.
I could do both. Digital health is a very specific industry. I would say be as close to care delivery as possible. Ultimately, the innovation within tech and healthcare is going to be a combination of your technology innovation, but also your go-to-market innovation, how you basically get integrated within the healthcare ecosystem. If you're building a technology and have no idea how people will use it and pay for it, there's very little legs for you to survive out there in the market. That's actually the extension of human-centered design, is that go beyond just the one person you're trying to improve their actual patient need, but the ecosystem around them. I would say broadly in life, position yourselves in a way where you can actually make things that are tangible. Even if your role is in modeling, in strategy, how do you make strategy tangible beyond words and going to things that people can experience? I think is the most important skill you can have. When I think about a lot of my strategy work, I'm literally building a version of the future. I mean, it's like, hey, this is the prototype of your company 3 years into your future. That is incredibly strong. So putting things out there into people's hands, I would say, is what you want to focus on, especially early in your career.
That sounds really inspiring. And you just really inspired me again for why I love design. And at the end of the day, it's about making things that are useful. So yeah, those are really important pieces of advice. We're out of time, but I wanted to really thank you for coming on, sharing your knowledge and experience. I'm sure a lot of people will find this really helpful. So once again, thank you so much for joining us.
Happy to be here.